Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Welcome to the deep dive, where we get right to the heart of the research that matters. Imagine just for a second, if a drug may be already known for one thing, like weight loss, turned out to have this huge, life-changing impact on something else entirely, something serious, like heart failure. Well, that's exactly the kind of exciting news we're digging into today.
It really is fascinating stuff.
Yeah, so this deep dive is all about groundbreaking new research. We're looking at these widely used weight loss injections and how they seem to dramatically cut the risk of a very specific, very challenging type of heart failure.
That's right.
And our sources. Well, we're drawing directly from a big new paper in JAMA, the Journal of the American Medical Association. Very prestigious. And we've also got a health news article that helps kind of break down these findings for everyone.
Good sources, solid basis for the discussion.
Absolutely. So our mission today is simple. Unpack this study, figure out what it means for people dealing with this tough kind of heart failure, and maybe explore how this whole thing shines a light on new ways we're actually discovering medical breakthroughs. Ready to jump in?
Let's do it. What's really key here is a specific condition. Heart failure with preserved ejection fraction, HFpEF for short.
HFpEF. Okay. Most people think heart failure means the heart's just weak, not pumping well. How is this different?
Right. So in this type, the heart's main pumping strength, what we call the ejection fraction, it's actually okay. It's preserved.
Preserved, okay.
The problem isn't the pumping out, it's the filling up. The heart muscle itself gets stiff, rigid.
It's stiff, like it can't relax properly.
Exactly. Think of it like trying to fill a balloon that's gone hard. It just can't expand easily to take in enough blood between beats.
Yeah, I see. So even if it pumps out okay, it hasn't taken enough blood in to pump out.
Precisely. And that leads to backups, pressure buildup, all sorts of problems. And critically, many standard heart failure drugs don't work well here because they target that main pumping action.
Which isn't the core issue in HFpEF.
Yeah.
Okay, that makes sense why it's been so challenging. And it's not rare, is it? You mentioned the numbers earlier.
Not at all. We're talking over 30 million people worldwide. It's a huge public health issue.
Wow.
And yeah, like you said, treatment options have been really, really limited. That's why this study is such a big deal.
And there's often a link with other conditions too, right? Like obesity.
Yes, very strong links. Obesity, type 2 diabetes, they often go hand in hand with HFpEF and can make things even worse. So finding something that helps these patients is crucial.
Okay, so that brings us to this new study. You mentioned it provides solid evidence, or maybe things were a bit uncertain before.
Exactly. There were hints from smaller trials, promising signs with these weight loss drugs, but not quite enough to change guidelines broadly. You know, cardiology groups, regulators, they were urging caution, needed more data.
And this study delivered that data.
It seems so. The researchers from TUM in Munich and Harvard Medical School, they specifically set out to test two drugs, Semaglutide and Tirzepatide, in HFpEF patients. Crucially, they looked at patients who also had obesity and type 2 diabetes, and they did it using real-world clinical data, not just a controlled lab setting.
Real-world data. That sounds important.
Yeah.
And the scale? I heard the scale was massive.
Oh, enormous. They used 3 big U.S. insurance claims databases, pulled data from 2018 to 2024, and ended up analyzing records from around 100,000 patients.
100,000. That's way bigger than typical trials for these drugs, right?
Absolutely. About 20 times larger than the patient groups in the earlier specific trials like STEP-HFpEF, FDM, and Summit.
Wow. So how did they make sure their approach with this massive data set was actually reliable? You mentioned benchmarking.
Right, benchmarking. It's a clever way to build confidence. Before they analyzed the whole group, they essentially used their big database to see if they could replicate the results of those smaller, known randomized trials.
Like checking their work against a known answer key first.
Exactly. And when they found their methods could reproduce those earlier findings, it gave them confidence that their approach was sound.
Makes sense.
So then they expanded the analysis to the much broader patient population you see in everyday clinics, not just the super select groups often in trials, makes the results much more generalizable.
Okay, and who were they comparing these patients against? They needed some kind of control group, right?
They did. They compared patients taking semaglutide or tirzepatide against patients taking a different diabetes drug called sitagliptin.
Sitagliptin, why that one?
Because previous studies, big ones, have shown sitagliptin is basically neutral when it comes to heart failure outcomes. It doesn't help, it doesn't hurt.
So it acts like a stand-in for a placebo. A placebo proxy.
Precisely. It gives a baseline for comparison without needing a traditional placebo group in this kind of observational setup.
Okay, sophisticated stuff. So, with all that in place, what was the main thing they were looking for? The primary outcome.
They focused on a really important composite outcome, the combination of being hospitalized for heart failure or dying from any cause.
Hospitalization or death. The big things.
The most serious events, yes. Combining them gives a powerful measure of overall major negative outcomes.
Right. So after all that setup, the benchmarking, the huge data set, what did they actually find? What was the headline result?
The headline is pretty staggering, honestly. Treatment with these weight loss medications, Semaglutide or Tirzepatide, led to a more than 40% reduction in the risk of that primary outcome.
Over 40% reduction in hospitalization or death.
Yes. Compared to patients taking sitagliptin, it's a really substantial effect.
That is huge, especially, like you said, for a condition with so few good options. Can you break it down by drug? Was one better?
Yeah, the numbers are interesting. Semaglutide, that's known as Ozempic or Wegovy, showed a 42% lower risk.
Okay, 42%.
And Tirzepatide Mounjaro showed an even slightly higher reduction, 58% lower risk.
Wow, 58%. So Tirzepatide looked even better.
Well, interestingly, when they did a direct head-to-head comparison between Tirzepatide and Semaglutide using their methods, they didn't find a meaningful difference in this specific outcome.
Oh, okay. So despite the different percentages versus sitagliptin, when compared directly, they both seemed similarly effective at reducing that combined risk of heart failure, hospitalization, or death.
That's what this particular analysis suggests. Both were highly effective.
That's really powerful information for doctors and patients. What about safety? Always a big question.
Crucial question, and the study looked at that closely. They checked for specific potential adverse events, things like GI issues, serious infections, UTIs, and they found no substantially increased risk for these issues in the patients taking Semaglutide or Tirzepatide compared to sitagliptin.
That's really reassuring. Good efficacy and a decent safety profile in this large group.
Exactly. It adds another layer of confidence.
Something else caught my eye. The researchers mentioned the benefits might show up quickly, maybe even before a lot of weight is lost. What's that about? These cardiometabolic mechanisms.
Yeah, that's a really interesting observation. It hints that these drugs might be doing more than just helping people lose weight, although that's certainly important. These cardiometabolic mechanisms could include things like reducing inflammation throughout the body, improving blood vessel function, maybe directly impacting how the heart handles energy, or improving insulin sensitivity.
So effects beyond just the number on the scale.
Potentially, yes. Benefits that might start protecting the heart fairly early on in treatment, even while the weight loss is still happening. It suggests a more direct beneficial effect on the heart and metabolism.
Fascinating. Lots more to learn there, I bet. Okay, let's zoom out. What does all this really mean for patients, for healthcare in general? What are the big takeaways?
Well, for the millions, literally millions, suffering from HFpEF, this is potentially huge news. It significantly expands the toolkit, offers real hope where options were, frankly, pretty limited.
You hope. It's massive.
And think about the healthcare system. Dr. Nils Kruger, the lead author, pointed out that heart failure is the #1 reason people get hospitalized in many places. It drives huge costs. If these drugs can prevent, as he put it, many hospital admissions, well, that's a win for patient health and potentially a big saving for the system.
Better outcomes, lower costs. That's the goal. And you mentioned earlier, this study might represent a shift in how we even approve drugs. Professor Schunkert's comment about data-driven approaches.
Yes, I think this is really significant. Professor Schunkert from TUM emphasized that the future belongs to such data-driven approaches. What this study shows is how you can carefully use large-scale, real-world data from actual patients in everyday care and combine it with the rigor we know from traditional trials, like through that benchmarking step.
So it's not replacing trials, but complementing them.
Exactly. It helps bridge the gap. It allows us to see how things work in a broader, more typical patient population than you often get in very selective trials. And potentially, this could help speed things up, get findings from research into actual patient care faster. Approving new uses for existing drugs like this might happen more quickly.
Faster access to potentially life-changing treatments for patients like you listening. That's a really important implication.
It really is, because these findings are likely applicable to a much wider group of people than those studied in the initial smaller trials.
Okay, this all sounds incredibly positive. But, every study has its limits. We need to be critical thinkers. What are the potential caveats or limitations we should keep in mind here?
Absolutely essential to talk about limitations. It's good science. First off, this was an observational study. It wasn't a randomized controlled trial where patients are randomly assigned to get the drug or a placebo.
So they're observing what happened in the real world, not controlling it directly.
Right. And while they used very advanced statistics, that propensity score weighting stuff, to try and make the comparison groups as similar as possible.
To account for differences between the groups.
Exactly. But there's always a chance some unmeasured differences could still exist between the groups that might influence the results. Some factor they couldn't account for.
Residual confounding, they call it.
That's the term. Now, the researchers argue that given the size of the effect they saw, that big 40% plus reduction, it's unlikely that confounding alone explains it all. But it's a possibility you always have with observational data.
Okay. What else?
Well, how they tracked medication use. It was based on pharmacy dispensing records. Did the patient actually pick up the prescription?
Right, doesn't guarantee they took it perfectly as prescribed. Adherence.
Exactly. Adherence can be variable. Also, some of the heart failure details, like the actual ejection fraction measurements, weren't always direct clinical reports. They were sometimes inferred using validated algorithms based on insurance claims codes.
So, interpreting patterns in the billing data, essentially.
Yes, using validated tools to do so, but still an inference, not always a direct measurement from a chart.
And that assumption about sitagliptin being a true placebo proxy. How solid is that?
It's pretty solid, actually. It's based on findings from multiple previous large trials that showed sitagliptin didn't impact heart failure outcomes. And this study's own benchmarking results supported that neutrality, too. So while technically an assumption, it's a very well-supported one, but still important to acknowledge.
Okay, so limitations acknowledged, but the researchers, like Professor Schunkert and Dr. Kruger, still sound very confident.
They do. They really see this as providing a robust basis for considering these drugs for HFpEF, potentially leading to expanded approvals. It really highlights this powerful combination. Check your real-world data methods against solid trial data, benchmarking, then apply it to the massive real-world population. It's a strong approach.
It feels like a significant step in how medical evidence evolves.
Yeah.
Leveraging all this data we now have.
It really does. Moving research findings into practice, potentially faster and with relevance to a broader group of patients.
So wrapping this up, what we've really unpacked today is, well, a potentially monumental step forward for treating heart failure with preserved ejection fraction, a condition where, let's be honest, the options have been pretty thin on the ground for a long time.
Definitely a challenging area.
And it's this fascinating story of existing drugs known for one thing, revealing these profound, unexpected benefits for something else, all backed up by this really smart, cutting-edge research approach that blends traditional trial rigor with the power of huge real-world data sets.
A great example of evolving medical science.
Yeah. So as you, our listener, go about your day, maybe think about this. How does this study show the changing face of medical discovery? How are these massive data insights changing our understanding of drugs we thought we knew? And what could that mean for how quickly new treatments, maybe even life-changing ones, get from the lab to your doctor's office? Something to ponder.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.